going to be assessing your head to toe physical exam, okay? Now, before we begin, do you have any pain right now?
No.
You need to go to the restroom?
No.
All right, very good. Are you comfortable?
Yes.
All right. So by this time, I'm going to check the patient's vital signs, which includes the patient's temperature, blood pressure, heart rate, respiratory rate, and the pulse oximeter, which are all within normal limits. I also check the patient's height, which is 6 feet, and the patient's weight is 180 pounds with a resultant of a BMI of 24, which is also within normal limits. I'm going to first start by assessing the patient's general appearance. Patient is a 26-year-old male in no apparent distress. Patient is alert, oriented to person, place, time, and situation. He is able to converse appropriately, he dressed appropriately, and he is able to follow commands. Now by this time, I'm going to have the patient also memorize 3 words in order to assess the mental state, which I'm going to do with my neurological assessment later on. So Mo, I'm going to have you memorize 3 words, okay? Apple, bear, and can. And then I'm going to ask these words again later on in the exam, okay? All right, so starting on for the patient's assessment with the patient's head and hair. I see that the hair is black, it is straight, it is evenly distributed to the front and back. I'm going to touch the patient's hair. It is silky, it is smooth. I'm going to check the patient's scalp. It is white, there's no dryness or flaking, and there is no wounds as well. I'm going to palpate the patient's head. Is there any pain anywhere here?
No.
All right. There's no tenderness, there's no mass, there's no depression or any deformity noted, and there's no pain as well. Now I'm going to check the patient's face. I see that the patient has 4 moles on the face. I'm going to check for asymmetry, for borders that are irregular, for color that is blue and black or variegated, and I'm going to check if the diameter is greater than 6 millimeters, all of which are negative for the patient. Okay, I'm going to check for the patient's face. I see that there's no wounds or any scarring. I see that the skin is intact. There is no drooping as well. I'm going to check the patient's facial expression. Can you smile for me? Puff your cheeks. Raise your eyebrows. Squeeze your eyes. All right. So patient's facial expression and features are equal and symmetric. That means that the patient's cranial nerve number 7 facial nerve is intact. Now I'm going to start palpating the patient's face, starting with the forehead, the sinuses. Do you have any pain?
No.
I'm going to percuss the sinuses. Now I'm going to palpate the patient's temporomandibular joint. Open your mouth and close. Move side to side. All right. Patient was able to move jaw side to side and front to back. All right. Very good. There's no crepitus. There's no tenderness upon palpation. He is able to move his jaw, so the trigeminal nerve or cranial nerve number 5 is also intact. I'm going to close your eyes. Can tell me if you feel any sensation.
Mm-hmm.
All right.
Yep.
Okay.
Yep.
All right.
Yep.
Patient is also able to feel a facial sensation, which means that cranial nerve number 5 is also intact. All right. I'm going to palpate the patient's temporal artery, which is also present. Okay, I'm going to proceed to the eye assessment. I see that the eyebrows and eyelashes are evenly distributed to both eyes. I see that the sclera are white. There's no redness. It's not icteric. There's no drainage or any periorbital edema. I'm also going to check the patient's conjunctiva, which is pink, moist, and intact. There's no masses noted. Now I'm going to have the patient read the Snellen chart. Can you please read the smallest line of letters that you can read?
LTFPH.
All right, now cover your eye with this board and read again.
LTFPH.
And cover your right eye.
LTFPH.
All right, patient's visual acuity is 20/20. That means that the optic nerve or the cranial nerve number 2 is intact. All right. Now I'm going to have you cover your right eye again. I'm going to cover mine, look at my nose, and let me know, tell me the word now if you see my fingers, okay?
Now. 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 Now.
All right, cover the other eye.
Now. 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 Now.
All right, very good. Peripheral vision is intact. I'm going to hold your chin and then follow my finger with your eyes only. Okay, very good. All right, very good. Cranial nerves number 3, 4, and 6, which is the oculomotor, trochlear, and abducens nerve is intact. Patient was able to follow the 6 cardinal fields of gaze. Now I'm going to check the patient's pupils. Pupils are equally reactive to light and also consensual light. Now look at the wall. Look at my finger. Look at the wall again. Then look at this. All right. Patient's pupils are also reactive to accommodation. So pupils are equally reactive to light and accommodation and are equally round with size of 3 millimeters. All right. Now I'm going to check the patient's optic disc. Go ahead and just look straight ahead. All right. The optic disc is pink. There's no hemorrhages, microaneurysms, or neovascularizations. Okay, now I'm going to proceed to the patient's, assessing patient's ears. I see that the auricle, both are in line with the patient's inner eye canthus. I see they are symmetrical. There's no drainage, no deformity as well. I'm going to palpate the patient's ear. Do you have any pain anywhere?
No.
All right, there's no tenderness or pain as well. Now I'm going to check the patient's ear canal. All right. Check here. All right. I see that the ear canal is pink. There's no excessive drainage. There's no cerumen. I see the umbo, the light reflex, and the handle of the malleus. I also see the tympanic membrane is pearly gray. There's no perforation or signs of inflammation such as redness or swelling. Now I'm going to perform a whisper test. Go ahead and repeat what I say, okay?
Apple.
All right. Baseball.
Baseball.
Patient passed the whisper test. Now I'm going to tap this equipment, and then it's going to produce a sound. I'm going to put it on the top of your head. Let me know if you hear it on the right side, the left side, or both, okay?
Both.
All right, very good. Patient passed the Weber test. I'm going to perform now the Rhine test. I'm going to do the same thing, but I'm going to put it on the bone in your back of your ear, and then after that on the front of your ear. Let me know when the sound stops, okay?
Mm-hmm. Yep.
Okay.
Yep. Yep.
All right. So patient passed the Rhine test. The air conduction is twice as long as the bone conduction, which means the cranial nerve number 8, which is the acoustic nerve, is also intact. Now I'm going to check the patient's nose, starting by inspection. I see that there's no deformity. There's no wounds in the nose. Or now I'm going to start palpating, okay? Do you have any pain here? All right, very good. All right, go ahead and blow through your right ear. All right, here. All right, very good. Both nares are patent. Now I'm going to check the patient's nose. All right. All right. Okay. I see that the nasal mucosa is pink. There's no mass or lesions. I see the nasal turbinates are pink as well. There's no mass or lesions or any drainage or bleeding. Now close your eyes. Let me know what you smell.
Mint.
All right, very good. Now I just tested the patient's cranial nerve number 1, which is the olfactory nerve, which is also intact. Now I'm going to check the patient's mouth, starting with the lips. I see that the lips is pink. There's no dryness or any chapping. It's moist. Now, can you show me your teeth, sir? All right, very good. The teeth are interlocked, so that's good. Stick out your tongue. All right, very good. All right. I just checked the patient's cranial nerve number 12, which is the hypoglossal nerve. Now I'm going to check your mouth. Go ahead and open up. All right, very good. I see the uvula is midline. I see the retrooropharynx is pink. I see also the tonsils are pink. It's not red or inflamed. It's hidden on the tonsillar pillars, which are also pink and moist. Now I'm going to test your gag reflex, okay? Now, open up. All right, the gag reflex is intact. That means that the cranial nerves number 9 and 10, 9 glossopharyngeal and vagus nerve is intact. Now stick out your tongue again. Tell me what you taste.
Sweet.
All right, very good. The patient's cranial nerve number 7 and 9 is intact for taste sensation. Anterior 2/3 of the tongue tests for cranial nerve number 7, facial nerve, and posterior third tests for cranial nerve number 9, glossopharyngeal. Now I'm gonna check your mouth. Open. I see that buccal mucosa is pink and intact. There's no lesions. I see the gums are pink and with clear margins. I see that the teeth is complete. There's no loose teeth or missing teeth. And now I'm going to palpate, okay? Is there any pain anywhere?
No.
There's no masses or lesions or any tenderness. All right, now I'm going to proceed to the patient's neck. Go ahead and relax. I don't see any jugular vein distension. I don't see any lesions. I don't see any wounds. Skin is intact. I'm going to proceed with palpation. I'm sorry, I'm going to check your thyroid now, okay? Go ahead and take a sip and hold it. And then tilt your head back and swallow. All right, thyroid is non-assistant when swallowing. I'm going to do palpation, okay? Palpating the lymph nodes and the occipital lymph nodes, postauricular, preauricular, retropharynx, parotid, submandibular, submental, anterior cervical, posterior deep cervical, and supraclavicular. Is there any pain when I was doing that?
No.
There's no adenopathy or any tenderness upon palpation. Now I'm going to palpate your carotids, okay? Artery. Okay, very good. Carotid arteries are strong. Now I'm going to have you sip again and hold it. All right. Go ahead and swallow. All right, very good. Go ahead and take a sip again. Hold it. Go ahead and swallow. All right, the thyroid is soft, it's pliable. There's no nodules noted. There's no tenderness. Is there any difficulty swallowing?
No.
There's no difficulty swallowing. Trachea is at midline as well. All right, now what I need you to do is to shrug your shoulders. All right, very good, and then just relax. I just tested the cranial nerve number 11, which is the accessory nerve. All right, now I'm going to expose your chest, okay? All right. Now I'm going to start assessing the patient's thorax and chest. I see that there's no any skin lesions, there's no open wounds. I see that the breathing is regular and unlabored. Go ahead, sir, and sit over here. Same thing in the posterior aspect. There's no skin lesions. Proceed now with testing the excursion. Go ahead and take a deep breath. All right, very good. Exhale. Same here. Take a deep breath. All right. All right, good expansion, symmetric on both sides. I have the stethoscope. All right, is it outside? All right. So I'm gonna now check the percussion. Go ahead and put your hands on the back. All right, so there's sorry about that. Forgot my stethoscope. So percussion has the resonant sounds on all quadrants. There's no sign sense of consolidation. All right, I'm going to proceed with percussion on the back, and I'll be assessing the diaphragmatic exertion. All right. So go ahead and take a deep breath and hold it. And I hear dullness over here. Go ahead and take exhale and hold it. Dullness over here. Same here. Take a deep breath and hold it. Dullness over here. Exhale and hold it. All right. And measure. And they are 3 centimeters on both sides, which is within the normal range, which is 3 to 6 centimeters. All right, now I'm also going to percuss and palpate your costovertebral angle, okay? Is there any tenderness here?
No.
Very good. And here?
No.
All right, very good. Now I'm also going to palpate and your spinal process. Now, beginning with inspection, there's no kyphosis or any scoliosis. All right, just tell me if you have any pain, okay? Any pain here? 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 Here?
No.
All right, here?
No.
Here? Here.
No.
There's no tenderness, step-offs, or deformities in the spinal process. I'm going to proceed with auscultation. Before that, I'm going to proceed with palpation. Can you please go ahead and say 99 for me?
99, 99, 99, 99,
All right, very good. And here as well.
99, 99, 99.
And good tactile fremitives. I'm going to proceed with auscultation. If you feel the stethoscope, just take a deep breath and exhale, okay? Okay, good. Deep breath. All right. Lung sounds are clear on all lobes, on both posterior and anterior aspect of the lungs. There's no adventitious sounds such as crackles, wheezes, or rhonchi, or pleural friction rub. All right, so go ahead and lay down. Now, in assessing the breast, we normally do a circular motion, seeing if there's any lumps or any masses, or if there's any tenderness. We also try to assess the patient's axillary lymph nodes by pressing on it. All right. Now I'm going to proceed and to assess the heart sounds. First, by putting my hand on the point of maximal impulse, feeling if there's any heaves or lifts, which is absent. See if there's any displaced point of maximal impulse, which is negative, and see if there's any thrills, which is negative as well. I'm going to listen to the heart sounds, starting with the second intercostal space on the right sternal border. I'm listening for aortic valve and pulmonic valve in the second intercostal space on the left sternal border, second pulmonic valve in the third intercostal space on the left sternal border, tricuspid valve in the fourth intercostal space on the left sternal border, and mitral valve on the fifth intercostal space on the mid-clavicular line. I hear S1 and S2 on all points. S2 is loudest at the aortic and pulmonic valve, and S1 is loudest at the tricuspid and mitral valve. There's no S3 or S4 noted. There's no murmurs or any sounds that indicates regurgitation or stenosis. All right, go ahead and turn your head that way, sir. I'm going to compare the carotid pulse and the point of maximal impulse, which is synchronous. I'm also going to listen to the carotid arteries. There is no bruit present. All right. Now I'm going to lay you back, okay? Now I'm going to start assessing the abdomen. I see that the abdomen is flat. There's no obvious deformity. There's no wounds. The skin is evenly distributed. The skin color is evenly distributed. I'm going to start in osculating the patient's abdomen. I hear active bowel sounds on all quadrants. I'm going to use the bell of my stethoscope and listen to the epigastrium. And there's no venous hum. I'm going to also check for the aorta, for the renal arteries, for the iliac arteries, and femoral arteries. There's no bruit noted. All right, I'm going to start percussing. I'm going to check for the liver size. I'm going to percuss, and I hear tympany. And now there's dullness, so I'm going to mark that one. Take a deep breath. I'm going to palpate for resonance. And there's dullness, so I'm going to mark that one. And I'm going to measure, which is 6 centimeters, which is normal, within reach from 6 to 12, which is the normal size of the liver. Now I'm going to start with palpation. Let me know if you have any pain, okay? Do you have any pain here?
No.
Here?
No.
Here?
No.
There's no tenderness on all quadrants. I'm going to try to palpate the organs. Take a deep breath, and then exhale. I can feel the liver. There's no enlargement. There's no hepatomegaly. Go ahead and take a deep breath, and exhale. I feel the spleen, and there's no splenomegaly as well. I'm going to try to palpate the kidneys. Take a deep breath, and then exhale. And I'm not able to palpate the kidneys. And same thing with the other side. Go ahead and take a deep breath. All right, and exhale. I'm not able to capture the kidneys as well. Now I'm going to proceed to the patient's extremities. First, with the upper extremities, I see that the skin is intact. There's no wounds or any open lesions. Do you have any pain here?
No.
All right. And check the patient's fingers and the nails. Capillary refill is less than 3 seconds, and the nails is approximately 160-degree angle. There's no signs of clubbing as well. Go ahead and try to lift your arm while I'm putting pressure. Okay, very good. And the other side. All right, very good. And do you have any pain in your elbow here and here? All right, there's no joint pain, and the patient's muscle tone is good muscle tone, and the strength of the upper extremities is +5. Now I'm going to check the patient's lower extremities. I see that the legs are also, the skin is intact. There's no open wounds. There's no obvious deformity. I'm going to palpate it, okay? Do you have any pain here?
No.
There's no muscle pain. All right, very good. Do you have any pain on your joints here?
No.
All right, I'm going to check your feet. I'm going to check the nails. They're all intact. Capillary refill is also less than 3 seconds. Now I'm going to check the patient's pulses. Your salus pedis is intact, +2 amplitude. And posterior tibial, the popliteal arteries, I can feel them. And the radial artery, also strong. And the brachial artery is also strong. Also going to check the femoral artery, and it's also strong. I'm going to check the pelvis, and it's stable. Now try to lift your leg up. All right, very good. And here, there's also a good muscle tone and muscle strength, +5 strength as well. Now I'm going to check the patient's. I'm going to proceed now to neurological assessment. Gonna lift the patient's head. Is there any pain when you do that?
No.
Okay, so it's negative for Brzezinski's sign or meningeal irritation. You're gonna raise your head now, okay? Now I'm gonna proceed with sharp and dull sensation. Go ahead and close your eyes, sir, and let me know if it's dull or sharp, okay? What is this?
Sharp.
All right, here.
Dull.
All right, very good.
Sharp. Dull. Sharp. Dull.
All right, so the sensation is intact. Now, let me know what you feel on your hand, okay? Close your eyes. What is this?
Key.
All right, very good. And tell me what number am I?
8.
All right, very good. So The anesthesia and stereognosis is intact as well. Now, go ahead and touch my finger with your index finger and touch your nose. Touch my finger, touch your nose, touch my finger, touch your nose. All right. So coordination is also intact. Can you do this? Follow this with me. All right. Fine motor movement is intact as well. All right. Can you remember the words that I told you earlier?
Apple bear camp.
All right. Very good. Tell me the date today.
It's the 2nd of November.
All right. Very good. So mental status is also intact. There's no problem with memory. Now I'm gonna test for the proprioception. Now close your eyes and tell me what you feel and where you feel it. Okay.
Vibration in my right knee.
Very good. Yeah.
Vibration in my wrist. Right wrist.
All right, very good. Proprioception is also intact. I'm gonna now check. Go ahead and take a seat over here and check your deep tendon reflex. Okay. First with the left. All right, intact. All right, very good. All right, it's intact. And deep tendon reflexes are intact. Go ahead and push towards me and here. All right, very good. And check the Babinski reflex. All right. Okay. Now go ahead and stand up, sir. We're gonna do range of motion. Okay. Go ahead and turn your head this way and the other way. Raise your hand. All right. Bend your knee and the other knee. All right. Range of motion is intact. Go ahead and walk and go back. All right. Gait is also steady. Go ahead and take a seat. All right. Range of motion. And I believe we are done. And that concludes our physical assessment. All right. Thank you.